here today to share some information with you that we're really excited about here at Biomed. KPMG has just released a study regarding non-invasive ventilation for patients with a diagnosis of COPD with chronic respiratory failure. Throughout this study, you'll see the difference in cost, mortality rates, and hospitalization rates. And as we go along, I want you to remember the number of patients included in this study, 15,608 patients total. When Medicare was approached and asked for the documentation on this group of patients to be released, they would only release 5% of the documentation. So that left us with the number of 15,608 patients. So, of course, this number is broken down into untreated and treated patients. Your untreated patient number is 14,230 patients. Your number of treated patients by other vent suppliers is 1,266, and your treated patients through Biomed, 112. So the first thing that we'll discuss is mortality rates. When you look at mortality rates, by the 6th week that the patient has been on non-invasive ventilation, you see a 16% absolute reduction in mortality rates. So this is consistent throughout the first 6-month period. So the way to look at this is every time that we treat a patient with non-invasive ventilation in the first 6 months, we're able to decrease mortality rates by 16%. So as that patient continues past that 6-month mark, we're actually able to see a relative reduction in mortality rates at 42%, which puts our number needed to treat 1 in 6 patients. So for every 6 patients that we set up on non-invasive ventilation, we're able to save 1 life. We like to use the drug Lipitor in comparison to these numbers. Lipitor is a very successful drug and very common, well known, but it takes, and it's also used, of course, to prevent heart attacks. You have to treat 71 patients with Lipitor to be able to prevent 1 heart attack. So as we move along, we'll talk about cost. And when you look at cost for the untreated patient, you'll see that the cost is just a little over $80,000 total cost per patient per year. Other vent suppliers just a little above $70,000, and Biomed is your lowest at $55,000 total cost per patient per year. So you can see a big drop from other vent suppliers to Biomed, but a very drastic drop from your untreated patients. And cost, it also, when we talk about cost, they bring up the RAD device. The RAD device, of course, is a BiPAP with a backup rate that has been ordered for this group of patients because it's known to be the least costly alternative compared to non-invasive ventilation. So you can see the cost listed on your handout, and it's just a little, well, it's right at about $70,000 total cost per patient per year. So this is not the least costly alternative for this group of patients and not the best type of therapy. So the last thing that we'll talk about is hospitalization rates. So when you look at hospitalization rates and look at your results, you can see that they're actually stair-stepped. So for your untreated patients, the hospitalization rates, the percentage is right at 25%. Your other vent suppliers right below 25%, and Biomed is actually below the 20% mark for hospital readmission rates. So to sum up this study and to put everything into perspective, non-invasive ventilation is the best type of therapy for this group of patients, your patients with COPD and chronic respiratory failure that you see having hospital readmissions. And you can see that non-invasive ventilation actually does cut down on healthcare costs. It decreases mortality rate and also decreases hospital readmissions. And you can also see throughout this study that Biomed is your best choice when ordering non-invasive ventilation. And not only is it proven, but I can tell you that Biomed, it has a very, very well managed ventilator program, very organized, And we have the best respiratory therapists in this type of business. And these respiratory therapists go above and beyond each and every day to make sure that these patients are taken care of to the best of their ability. So with this being said, when you put the best respiratory therapists that you have in the patient's home with the best technology available for this type of patient combined, we're able to decrease the hospital readmission rates, and these patients are able to stay at home and live their lives.